Hello, my colleagues in the NICU at Joe's. We are presenting this online education on family integrated care to improve our knowledge, motivation, and self efficacy to promote this care model in our NICU. It was introduced about 3 years ago to our NICU. Since this care model was introduced, we have seen how it has impacted our families that took part in this new model of care. Although it is fairly a new model of care, it has gained momentum in many countries like Canada. Shannon Brinker, our occupational therapist, and I, Manoj Sebastian, the NNP, has worked together to put forth this educational video in the hopes that this would help all of us to embrace this care model more, that this would become the standard of our practice in our NICU. When we have when we have a lot of evidence that FIC is beneficial to infants, families, staff, and to the organization, why not make it our standard of care? The objectives of this educational video, is to re-educate our nursing staff and all the non-nursing staff who have direct patient care role about FIC. The objectives of this education session is to improve staff's understanding and knowledge of the benefits of FIC so that staff would better understand the four pillars of FIC. Staff would appreciate the role of nursing staff in the successful hardwiring process, and finally to help all of us to understand the evidence behind FIC so that our motivation and self-efficacy will reach a higher level to promote FIC in our unit. Admission to the NICU can be very stressful for parents. Despite many efforts to support parents cope up with the stress of NICU, parents feel stress and lack of control during their infant's stay in the NICU. In addition to the feeling of disempowerment, they also encounter anxiety and feeling of poor parenting abilities. Care of infants in the NICU is generally provided by specially trained nurses. Evolution of a care model called family integrated care over the past few years have shown positive outcomes for infants and their families. Many care models like family-centered care, kangaroo care, skin-to-skin care have evolved over the years to support families to feel less stressed and to feel more connected with their infants in the NICU. Although these care models promise many positive outcomes, FIC has more to offer. Many studies like the one done by Dr. O'Brien in Canada have shown evidence that longer, stronger, and responsive parent-infant interaction can improve behavioral outcomes in preterm infants, in addition to many other benefits. Family integrated care is a comprehensive care model that aims to improve parents' practices in the NICU by promoting a central role for parents as active caregivers for the infants in the NICU. Family integrated care program focuses on increasing parental presence and collaboration between staff and parents. Parents are true partners in the NICU while FIC is encouraged.
FIC or FICARE program was based on humane neonatal care, a model developed by Adkin Levin in Tallinn, Estonia in 1979. During this time, in Estonia, a country on the eastern coast of the Baltic Sea in Northern Europe, there was a nursing shortage. Dr. Adkin Levin, a professor and a pediatrician at the Children's Hospital in Estonia, designed this care model where parents would provide nursing care as a strategy to solve the nursing shortage. The model was based on a conceptual model, psychological and biological umbilicus, which proposes that this connection binds the mother and infant together during early weeks of life. The parents took care of their infants after basic training, except for respiratory care and IV medication infusion. This approach showed that parents felt more comfortable at the time of discharge to care for their infants and also showed improved outcomes for their infants. Like any care model, FIC is goal-oriented. Collaboration stands for relationship that is characterized by complex interactions and relationships between nurses, families, and providers. A successful partnership is achieved when the goal of care and collaboration are shared and negotiated between nurses and families. Keown and Cowley in their paper titled Challenging the Philosophy of Partnership with the Parent, said to achieve a partnership, nurses must be able to facilitate the partnership by respecting parents' perspectives. Sharing knowledge leads to creation of mutual knowledge. Nurses have medical expertise and competence, while parents have expertise regarding their own lives and living with illness, and only sharing can create mutual respect. If we do not interact and share our knowledge, it is difficult to create a common goal. Interactions are effective communications. They lead to improved relationships and trust. Nursing demonstrates medical expertise combined with sympathy, empathy, and affection, and this should be communicated to create meaningful interactions. Confidence is achieved in FIC by providing a combination of education, physical support, and psychological support. As the parent's confidence improves, they become primary caregiver for their infants. Let's listen to what Dr. O'Brien, one of the pioneers of FIC from Toronto, Canada, has to say about the philosophy of FIC.
The philosophy of family integrated care is that families should be allowed to participate to the best of their ability in the care of their infant, even when their infant is sick. And that can look different for different families. It can look different for different hospitals, depending on what supports they have available for parents. But the idea is really to support parental presence and parental engagement in their baby's care. The results of the pilot study were able to demonstrate that the parents actually had less stress when they were in family integrated care. The babies grew better when they were in family integrated care. There was less nosocomial infection. There was less retinopathy of prematurity, in fact, in the babies who were in family integrated care. And this makes sense to me. Parents being at their baby's bedside will actually both protect the babies from infection and decrease the risk of there being errors at the baby's bedside.
Although family-centered care and family integrated care may appear similar to many of us, they are different. They both are care models that are valuable to the infants and families. Family-centered care is a care model where healthcare professionals support families to be more involved in their care, whereas family integrated care takes it further and tries to promote parents to be the primary care providers for their infants. The overall goal of family integrated care is to achieve parent competence and confidence, family well-being, and improve infant outcomes, whereas the overall goal of family-centered care is to improve family and infant outcomes through partnership with families in delivery of NICU care. St. Joe's was the first NICU in Colorado and one of the first in the U.S. to implement this program and start a change in practice. Due to current research, many institutions on their own or as part of VAUGHN, the Vermont Oxford Network, are implementing family integrated care and units as part of quality improvement and best practice initiatives. In the highly technological environment of today's NICU, infants are physically, psychologically, and emotionally separated from their parents. These environmental elements may adversely affect parents and infants. The NICU can be very stressful, as we all know, for parents and infants and act as a barrier for physical and emotional bonding. Lack of adequate emotional bonding leads to a sequence of problems like poor long-term outcomes, behavioral problems, decreased weight gain, poor breastfeeding, and increased parental stress. FIC has proven in many countries that it can reduce poor outcomes and increase physical and emotional bonding. The improved health of our infants means improved health of our citizens, which means improved overall health of our country. We have learned that FIC Care was developed in Toronto following the publications of Dr. Levin in Estonia. FIC Care program is based on 4 pillars: staff education, parent education, environmental support, and psychosocial support. Preparation for change in practice is essential, and changing from family-centered care to family-integrated care is no different. Staff education is vital for the success of FIC. Staff education should provide opportunities for them to express their concerns about this new care model, as parents are expected to be the primary caregivers in permissible situations. Some worries staff may have are fear about role change, where they feel parents are going to take over their role. Many successful units where FIC have instead shown that family integrated care only integrated parents into the care, and parent-nurse relationship improved. Professional education can help in helping staff to eliminate this unnecessary fear and can help them become coaches and educators for parents to provide basic infant care needs. For those of you who are newer to the unit, our microsystems group provided a 1-hour education session at Skills Fair before rolling this program out, and we got staff and family feedback by starting with a pilot group of 4 families. New hires also have a required E-module. The second pillar, parent education, is a pillar of aiming to shift bedside education by the nurse to teach parents how to perform basic cares for their baby and teach them principles of developmental care and how to read infants' cues. Multidisciplinary education versus just nursing education can help parents to have a broader idea of family integrated care. Our website education allows for consistent education on each task, no matter which caregiver is teaching, and allows for different learning styles. It also helps keep a record of training for Joint Commission standards. Psychosocial support or peer support is a key element in family integrated care. This pillar has wide meaning and application. We all know that someone who has lived the experience knows more. An ex-NICU parent training a new parent definitely means a lot more than a nurse or a physician teaching these parents about FIC. Providing this support can enable parents to be active participants in medical rounds. This allows them to ask questions and feel fully included in the plan of care. Environmental support, the 4th pillar, refers to all creative strategies to maximize space for families to practice FIC. A rooming in space, a space for parents to sleep by their baby, etc., will support implementing family integrated care.
Family integrated care is really built on the principles of family-centered care. It's not completely separate from it. But it's actually gone one step further, which is to actually say, okay, if you're going to integrate families into the care of their infant, these are the 4 pillars that are required to actually support their integration into the unit. It's not enough to say we're family-centered and expect integration to happen. You actually have to make it happen by providing these extra supports. First of all, you need to actually train your staff so that they can support parents in this kind of role. 2, we need to support parents so they actually have both the skills and the confidence to be at the bedside. And part of that skills and confidence comes from parents presenting on rounds and becoming more part of the medical team. And 3, we need to actually provide an environment that is conducive to having parents present. And that means providing comfortable chairs, a place for parents to prepare food, and also having open visiting policies, and ideally supporting their parking. In fact, parking can be a big barrier to parent visitation. The 4th pillar is actually that peer-to-peer and veteran support. We found that's really key in supporting parents, again, in their role as caregivers in the NICU. So what I want people to know is not to see family integrated care as a barrier to care, but rather do with what you have. It's sort of one of those things, yes and. So move forward with what you can, if that be a parent education program, if that be parents on rounds and facilitating prolonged parent presence. Those can be done no matter what physical environment you're in. Those can be done no matter what sort of resources you have. And I hope you find on our website ideas of how to do that with what you have.
This is just a slide to show you that there is so much evidence behind family integrated care. There are so many published papers about the benefits of FIC, And there are also many papers that are being worked on to publish about the benefits of FIC. I do have a list of references for you at the end, but this is just to show that this is not something that just has popped up. There is so much evidence behind it. A multi-center randomized controlled trial among 26 tertiary NICUs in Canada, New Zealand, and Australia conducted a study among parents of infants born at 33 weeks or less to evaluate the effect of FIC compared to standard care. The study included 895 infants in FIC and 895 infants in the standard group. The study showed that on day 21, weight gain was higher in FIC group versus standard care group. Average daily weight gain was higher among infants who received FIC care. 70% of the FIC care group infants demonstrated high frequency breastfeeding versus 63% among the standard care group. On day 21, parents of FIC care group showed lower mean stress scores and compared to the opposite group. A pre-post intervention study was conducted in NICUs in 2 Chinese children's hospitals. Infants with BPD were included in the study. Pre-intervention group, which was non-FIC group, had a number of 134 participants, and the study was from December 2015 to September 2016. Post-intervention group, which was the FIC group, had a number of 115 infants and their parents from October 2016 to June 2017. Compared with the control group, FIC group had significantly increased breastfeeding rates, 83% versus 71%. And they also showed that breastfeeding time, 31 days versus 19 days, was also shown when they compared 2 different groups. Enteral nutrition time, 50 days versus 34 days. Weight gain, 29 grams per day versus 23 grams per day. And significantly lower respiratory support time, 16 days versus 25 days, was also noticed in this study. Many studies have shown that participating in FIC care model improves parental confidence in aspects of caring and decision-making during NICU stay. Parents who took part in FIC have stated that they feel more assured in providing care as well as in asking staff questions to staff members. Taking part in FIC also has enabled parents to be more clear about their role. It is needless to say that parents who took part in FIC felt more emotional attachment with their infants than parents who did not take part. Study by Dr. O'Brien and group noted that on day 21, parents of FIC care group showed lower mean stress scores than the opposite group. We all know how important communication is to provide quality patient care. We all know that breakdown in communication can lead to increased stress. Stressful situations like NICU is a precipitating factor for communication issues. Being partners in care and plan of care improved communication is achieved with FIC in action. A registered nurse who is familiar with FIC will be attracted to a hospital that embraced FIC care model. It helps hospitals to recruit more talented staff. A study conducted by Benzies and team in Canada showed that the average length of stay for infants admitted to the level 2 NICU in Alberta, Canada, was about 16 days with an average per diem cost of 788 Canadian dollars. If FIC reduces length of stay by 10%, it would reduce costs roughly to $39,000 versus $43,000. Imagine this over a year for a set number of infants in our NICU. The relationship between NICU nurses and parents is a key factor that facilitates the success of FIC. It will be unrealistic for the steering committee of FIC to think that they can hardwire FIC without nursing buy-in. Bedside nurses not only play a key role in sharing vital information to families, but also in helping parents grow into the role of a primary caregiver. Nurses are the eyes and ears of infants. They are the advocates of infants and their families. More than any other discipline, nurses spend more time with the infants and their families. They begin their role as the infant arrives to the NICU. They orient, they inform, they encourage, they touch and coach and teach the parents about all aspects of NICU care. In addition to the role of nursing, nurses play in nurses also play a vital role in assessing the parents' skill and capabilities while they are in the NICU. Nursing of all disciplines deserves the most respect if FIC is hardwired in a NICU. Lots of times, in the middle of complex NICU care, nurses unintentionally push parents into the background of the NICU environment. This leads to task-oriented patient care as opposed to patient-centered care. Galarza Vinton in 2013 noted the importance of nursing curriculum framework to support FIC. They identified 5 areas of focus. Understanding the parent experience in the NICU being number 1. Number 2, recognizing parents' psychological challenges. Number 3, addressing the challenges of developing a therapeutic relationship. Number 4, providing a therapeutic appropriate care. And finally, supporting parental competency and overall family functioning. Facilitation of individualized integration requires a nurse assignment system that addresses the family's learning and support needs as well as infant's trajectory of illness. Motivation is something we all wrestle with at some point or another. Motivation is an internal process. Whether we define it as a drive or a need, motivation is a condition inside us that desires a change, either in the self or in the environment. Motivation is derived from the word motive and explains why we do what we do and what drives our behavior. Sustaining FIC definitely requires motivated nursing staff. Self-efficacy captures how a nurse perceives her or his ability to integrate FIC rather than her or his actual ability to integrate FIC. Nursing staff with a high self-efficacy are able to overcome barriers than those with low self-efficacy would find it overwhelming. Believe in yourself. Yes, we can do it together. Like Gandhi said, if I have the belief that I can do it, I shall surely acquire the capacity to do it, even if I may not have it at the beginning. Essentially, what he is saying is, if we believe in ourselves, we can do it. So it's all about our perception. Let's believe in ourselves in embracing family integrated care. I'd like you to listen to Dr. Pantoja in his testimonial.
Thank you, Manoj, for asking me to say a few words about a topic that I feel very passionate about. When I first heard about the concept of integrated family care in one of the Vermont-Oxford Network meetings from one of the leaders from the Canadian network, I felt that this way to do neonatal care was going to make a real difference in the care of our infants and their families. Recent reports in the literature about the implementation of this concept, where the parents become authentic partners with the NICU team, have been very clear. It improves important neonatal outcomes, such as growth, decreases duration of hospitalization, increases maternal milk production, and perhaps decreases important complications such as nosocomial infections, retinopathy of the premature, and bronchopulmonary dysplasia. My experience as a parent, and recently as a NICU grandparent, makes me believe that this partnership decreases stress and anxiety in the parents and their families. My experience with families in our NICU that became motivated to adopt this approach to neonatal care makes me believe that the participation of our nursing staff has been the most important factor in the success of this program. Our nurses, especially those that committed to the primary role, acting as real advocates for their patients, has motivated and coached many parents to make them participate at a level that they feel comfortable. I think that strong engagement of all the members of the NICU team is very important for the continuation and success of this program. Thank you.
And now from one of our families who is really a big supporter of family integrated care and involved in every aspect of family integrated care. Here's a statement on how important they believe that it is for caring for their baby.
Family integrated care made a huge difference for our family. I'm really glad that we opted into it.
It was really nice being able to do rounds in the morning. It gave you a sense of control in a situation where there was little that you could control. It was nice being able to stand up in front of your peers, presenting the data, and having them kind of correct you if you needed correction, or applaud you when you pretty much nailed everything that you knew. It was a good feeling.
And while it might be a little bit scary at first for parents, it definitely helps you understand what's happening in the NICU. And like Jake said, with control, it helped me really understand terminology, it helped me understand the devices, and it helped me truly advocate for our son, which made a huge difference. And I think ultimately, the more that you learn in the NICU, the more confident of a parent you're going to be when you leave that space with all the wonderful help and support that you have. Family integrated care helps you advocate for your child.
I agree.
So ultimately, once we can actually implement and hardwire this program, I think it's a celebration. It's a celebration for staff, it's a celebration for the hospital, it's a celebration for families, it's a celebration for the infants. So why not celebrate? So let's embrace this new care model. That is the end of our presentation. I know during these COVID situations, I cannot really answer the questions face to face. So please email me if you have any questions. I'll be more than happy to get back to you and give you the answers that you all are looking for. Some of the references are listed here, and as I said, I have a lot more references in my file. I have probably about 40 published papers that I have gone through, and I'll be more than happy to distribute the references as well. And also we did get the permission from Dr. O'Brien, Toronto, Canada, and also the families who you have seen earlier. So I hope this helped to embrace the new care model, and I hope we all can support and promote this care model to every family in our NICU. So let's celebrate.